Hey, micro friends, welcome to another episode of Let's Talk Micro. As always, I'm so happy that you're here with me. And if this is the first time you're listening to Let's Talk Micro, well, thank you for choosing it as one of your podcasts. Okay, so today's episode is long, so I'll be brief. And those of you that have been listening for a while, you know that we did an episode about the CPEP fellowship with Sam Goodfellow. And we also did an episode about the ABMM examination. And I have included the links to both episodes on the show notes. But on today's episode, I am joined by Dr. Mackenzie Collins, and she's a CPEP fellow at UCLA. And in the episode, she joins us to talk about her journey from a medical laboratory scientist to a PhD and now a CPEP fellowship. And in the episode, she talks a little bit about the process of the CPEP fellowship. She talks about how, skills that you acquire as a medical laboratory scientist help you to eventually become a microbiology laboratory director. And she also talks about, things that you can do to have a stronger application to to grad school or a CPEP fellowship. And she also talks about genomics and the fact that things like sequencing is something that medical laboratory scientists we need to embrace. It was such a great conversation, so let's go ahead and listen to it. Hey, micro friends, those of you that have been listening, do you know that we did an episode before on the CPEP fellowship? And by the way, shout out to the CPEP fellows. From their early days, they are listeners of the podcast. And every time I go to a meeting and I see them, they always say hello. They tell me how much they appreciate the podcast, and so I really appreciate all of you listening and your support from, as I said, from the early days. So I did an episode a while back about the CPEP fellowship with Sam Goodfellow, and today we're going to talk a little bit more about this subject, but I have a CPEP fellow that was a clinical laboratory scientist. So it's very interesting, and I want to hear her journey. So with me, I have Dr. Mackenzie Collins. Mackenzie, welcome to Let's Talk Micro.
Hi, Luis. Thanks for having me. Super happy to be here and talk to you about the program a little bit.
My pleasure. Thank you for taking the time. So let's go ahead and start with a quick introduction. Maybe what can you tell us about your current role and training and anything else that you want to share with the audience?
Sure. Yeah. My name's Mackenzie. I'm currently an almost second year fellow at UCLA, which is part of it's a part of the CPEP program. The CPEP program. There's about roughly 20 different medical institutions that offer a CPEP program, which is just stands for like Subcommittee of Postgrad Education Programs through ASM. And so I've been here for about a year now. And before then, I moved out here to LA. Before then, I got my PhD at Drexel University in Philadelphia. And then, like you said, before that, I did my undergrad at UNC Chapel Hill in the CLS program there and got my CLS license there and was a technologist in the molecular microlab at UNC hospitals for about 3 years before leaving for grad school.
So you did your training on the East Coast, and then you moved to the West Coast. So out of curiosity, are you from the East Coast?
Yeah. I'm from North Carolina originally, so all my family's kind of out there, and yeah. This is my first time living on the West Coast. I'm enjoying it. We drove out here. I have a dog, so we drove out here over like 3-4 days. I defended my thesis, and then the next day drove across the country to move out here and started fellowship like a few weeks later. So I had a couple weeks off before fellowship started.
Yeah, I did that a couple times in my life. That I went from the East Coast to the West Coast and then back. I drove from Virginia to Washington State one time, and then the next time was from Washington State to Florida. So I highly recommend it if people have the time, and most people do it for because they're moving, school, job, and things like that. But it's highly recommended. It's beautiful and see how the landscape changes, and it's great. Taking those 3-4 days and driving across the nation. It's a great experience. So I definitely recommend it. Um, you told us what you do, what you did, and maybe I just it brings the question to mind. So what initially drew you to to laboratory medicine?
Yeah, so I mean, it was kind of a when I was younger, I mean, I think a lot of people will say this like, "Oh, I didn't know that this was a potential career path, and I didn't know this was part of like healthcare teams." And so when I was in high school and like freshman year of undergrad, I thought I wanted to be a physician or something like patient facing. I was always interested in medicine and science, and um, to that extent, I started volunteering at the hospital and when I was an undergrad at UNC, and that's kind of part of like what you should do as a pre med student is to go get experience in volunteering in the hospital. And so I did some volunteer work in the ED and the cardiac ICU, sort of my freshman sophomore year, just like handing out blankets, restocking, directing calls, and that to me was so intense. And I just have so much respect for the people on the floor, taking care of patients, and they're so valuable. And I just, from that experience, I kind of realized that I might not be the right personality fit for that. And, it's, and so I started kind of looking at other options, and I took a medical microbiology class that was kind of tailored towards like pre-nursing. And so it was sort of just like the fundamentals, disease or bug disease association and treatment. But I really loved that class. And in that class, one of the CLS instructors from the program at UNC came in and kind of just gave a little information session about here's another allied health path that you can take. And yeah, so I applied to that and immediately was just I loved it. And I think it's such a unique position that we have as laboratorians to still be able to like be a part of patient care and do what we can to help patients, but kind of be in a more regulated environment. I guess is a way to put it, a more predictable environment. And so to that extent, I definitely would recommend if you were someone like me and interested in medicine in general, I definitely would recommend volunteering in hospitals and trying to see that like that patient care to see if it's a good fit for you. And then, also that like if you're interested in lab science, like go into labs, try to contact some of your local labs and see if you can go in there and just take a little tour and they'll tell you kind of what their day to day is like and get a better feel for what might be a better fit for you. But um, to me, micro was the most exciting part of it. And though I do have a generalist license, and I was able to go through all the other rotations that we were required to do, which were very valuable for being a CLS as well, so, or for being a CPEP director as well. I mean,
Yeah, I'll ask you more about that. But yeah, and for those that are listening, and your typical lab program that you do, there are different versions out there. One's a bachelor's or post that or things like that. 3+1, 4+1, and things like that. But yeah, you come out trained in all the areas of the lab, and like you said, sometimes a lot of people do find out either late after they have graduated or maybe they were unaware that it existed. I really like how you expose yourself to some things and find out from there what you wanted to do. Right. And microbiology is amazing. It is. And it definitely, for the lab, there's always this allure to people when they do it that they want to be in healthcare. A lot of them, they tend to be like introverts. So there's like a more limited interaction, like your patients are your doctors. That's in the people to people interaction that you have. It's just, on the phone, reporting results and things like that. So traditionally, right, a lot of PhDs, or we see like directors. There's like typical path where you do all your school together, right? You do your undergrad and then you go to grad school, finish, and go from there. And then there are others that maybe along the way they figure that they want to continue going to school, or they had to pause for some reason. So in your case, right, you did undergrad, you're working, as a CLS. So what's maybe tell us about your journey, what why that interest, why did you decide to pursue that, and talk about your PhD and CPEP training.
sure. Yeah. So, I mean, when I was in the CLS program at UNC, I was lucky enough to get a part time position in the processing area. And so I would go do my like externship rotations, whatever special heme that we were doing as the second year of my CLS program. And then I would work for 4 hours and after in the evenings, kind of like from 5 to 9 or 4 to 8, kind of when processing's really busy, with surgical samples or like courier samples. If you're from, if you've ever worked in processing, like it can get kind of busy. And so I worked in that area as a student. And I think I was able to like form those relationships with the people in the micro lab there. And so the director at UNC, who's still there, Dr. Melissa Miller, she was able, like as I was graduating, to offer me a position in the molecular micro lab there. And so my role there was doing just, routine clinical diagnostics. We did, viral loads and the multiplex panels and all that, that were, we have a lot more of now. This is back in 2017, I guess I started to be, I graduated my CLS program. And so I was doing the routine testing, but she was also working with me and giving me kind of small projects, towards sort of like an antimicrobial stewardship, uh, capacity. But basically, the way I was supporting the stewardship team, a lot of hospitals have like antimicrobial or diagnostic stewardship teams, was bringing on assays, and kind of doing projects to evaluate and validate assays that would give you quicker AST, prediction. And so I validated at the time a few things, projects that I was working on kind of on the side, while I was doing my clinical testing responsibilities. I did like the expert carbapenemase detection, the Cepheid, that detection and validation of that assay, because that was a big issue at that time. We were bringing on, we were just doing gram positive rapid blood culture ID, and then we were bringing on gram negative. And so projects sort of like that. And then another opportunity like that big institutions have is, companies come to you with like product evaluations, for like new, so here at UCLA, we kind of have like an R&D section that handles that, but doing evaluations of new pipelines for that. And so I was working on all these projects that also gave me the opportunity to do posters and writing up kind of like even just QI projects. So these are the kind of things that you can do, and we could talk more about things that things that you can do to kind of get experience beyond the bench, which is valuable for grad school applications. And so I was doing those projects, and I was able to do some posters. I went to Microbe in 2018, and that was like awesome. I was in San Francisco that year, the year that I went. So I was able to present at Microbe and even publish a paper doing evaluation on a novel multiplex BAL platform. So, and then so Dr. Miller has been a great mentor and is always encouraging me to pursue things further. And she encouraged me to apply to grad school, and I was able to I applied to I had 3 different grad schools, and I was accepted to Drexel in Philly. And I went into grad school sort of, knowing that I wanted to come back and do the CPEP fellowship because, in my training under Dr. Miller and just my love of clin micro in general, like I did not go into grad school for any other reason than to come back to this. So I felt really supported both from UNC and then at Drexel from my PI and people there. So yeah. And then CPEP fellowship, you'll start planning to feel CPEP fellowship once from your PI, like when you're going to be able to defend. And so it's kind of always a discussion there, and it's always important to be clear with your PI in grad school what your career intentions are, and so they can support you in the best way possible.
And that is so wonderful, when you mentioned about Dr. Miller, it's always great, right, to see that type of mentorship. Sometimes the lab, unfortunately, with the volume and things like that, it can be such a busy place where we have a job to do, and we go in, we have to get it done, and but people taking the time to nurture and mentor, that's well needed when you see potential, getting people involved in projects, and that's how sometimes people discover that maybe I want to do something a little else besides just working on the bench, which is a great job and things like that. But sometimes some people feel that maybe I can contribute in a different in a different way, either through validations or getting training to eventually direct a lab. So I don't know, it's very refreshing and great to hear. So thank you for sharing that with us. So, and you mentioned, so it was a good experience, and of course, anything has challenges. So do you have any challenges making that transition from CLS to PhD and entering CPEP training?
Of course, yeah. I mean, in terms of challenges, I think the normal challenges that CLS and healthcare workers probably in general can experience sometimes, like you're saying, it's always, sometimes we're super busy and we have no control over, when you go take a break and, that sort of thing. And so I'm not saying we should normalize working through burnout. Like it's important to have your feelings and experiences heard, and not to bring it up, but it was a tough time for anyone to work in a hospital in 2020. Our molecular lab, of just like 6 people across 2 shifts, no weekends, started having to do, 24/7 operation. I was working nights by myself, trying to run as many manual COVID PCRs as I could, as quickly as possible. And, all the other things that came with, working in the lab in 2020. But I think that time like definitely solidified for me the responsibility you, we feel, to do what you can for the patient and, just public health in general at that point. And so all results we put out, carry weight. And so just practicing maintaining that standard, even when you're stressed, and knowing when to ask for help and communicating when you're busy and when things like the interface go down and things like that. I think we had a really great team there at the time. So I learned a lot there, and I felt extremely supported both, by Dr. Miller and just, everyone within the lab. And so I think that's really important. So.
That was a tough time to be in the lab. Definitely a lot of challenges, as those of you that are listening, and I experienced them as well. Getting through all those things and a lot of testing during that time in COVID, and supply shortages, a lot of losing a lot of staff. Like a lot of people that had been working for a long time were like, well, maybe this is my time to retire, right? Just getting. So we were dealing with all those things. It was definitely a challenge time, and but thankfully we pulled through, and here we are bringing good work to our patients. So when it comes to the let's talk a little bit about the CPEP fellowship. And I know, like, as I mentioned earlier, and I'll put the link to Sam's episode on the show notes to reference it. He also explained his journey and he talked about it. So can we talk a little bit more about the CPEP fellowship and what the pathway looks like?
Yeah, sure. So the CPEP fellowship, it's open to anyone with a PhD, MDs, DOs. It's not open to people with PharmDs, I believe, and then also the director of CLS. I think at this time is not a degree that's accepted by CPEP programs, but basically, the CPEP it's a great program. I think I feel really supported by the directors and the CPEP, just committee in general. But it's it's a 2-year fellowship. Again, like I said, you have to have that postgraduate degree, and that your first year basically. So my last year, this past year, you rotate. It's kind of like a CLS externship plus, where you're doing all the rotations, because most of the CPEP fellows in my cohort do not. I think there's a couple other first year fellows that have a CLS degree, but most of the fellows in my cohort do not have that clinical lab science background. And so it's really important for them, especially, and it's great for me because I definitely needed a refresher, and I never worked on a BAC-T bench. I was very molecular. So I was really excited to get into like BAC-T and AST and really like get on the bench, get that bench training. And so, yeah, we rotate through every section of the lab. I just finished my last rotation, which was in serology, and they kind of put us through like a CLS program. And so that's, great background to have if you're going to be doing that again. And then on top of that, you're responsible for projects like, for example, there's a measles PCR need at the moment. And so it's not something we previously had in house. And so that's one of the projects that you can bring up as a CPEP fellow. We spend a lot of our days on calls with physician teams. So we have like a PEDS ID call, an adult ID call, a transplant ID call, for like an hour, hour and a half a week. Usually it's like discussing cases, and we're kind of like there as a live resource to offer them like testing options, or talk about limitations of testing results, for example. So that's a really fun part of my day. And then yeah, just we hear also lectures from the physicians as well. So we're getting like a little bit of like medical background, which is also a huge part that I think CLS students, like, or CLS professionals, like kind of have that background of like non-infectious medical results and presentations and stuff. So a lot of my day is trying to like understand things outside of infectious disease as well, and just coordinating with the teams, the primary care teams, and liaising with the lab, obviously, get the right test results and requests and that sort of thing. So, but yeah, basically, and then at the end of the 2 years after, so I did my I did the bench training, which is the first year, and then the second year, you're out with those teams, actually rotating, like seeing patients along with them on the floor. We do a rotation at the VA, and then a rotation at the public health lab, which is I'm also really excited about, because I don't really have a lot of experience in the public health space, and the clin diagnostic lab and public health can have some differences. So and then, yeah, so after that, those 2 years of training, we will be eligible to take a board exam. And so, in order to be a medical micro director at most institutions, you need to have an ABMM certification, as American Board of Medical Microbiologists. So,
Yeah, and for the listeners, I'll also put the links that I did before about the ABMM examination, that I did an episode about that. So I'll put it in along with Dr. Goodfellow's episode, so you can go back and refer to them. So yeah, being a director, right? That's a job that requires a lot, right? Just like if you're working in the lab, at the end, you have an issue, even from the bench tech perspective. You have an issue, a complex case, something that you don't know. At the end, it rests on the director. At the end, goes to him. Then all the other things, right, like test implementation, keeping up with things like breakpoints and things like that. So that job entails a lot of knowledge and responsibilities. And those of you that are listening in the audience, that are medical lab scientists, there's a lot of qualities and training that you acquire in your job that I see that it will make you a good fit to be a director, getting that additional training and education. So, right. So maybe you can tell the audience about, what unique strengths, a medical lab scientist, clinical lab scientist, brings into that CPEP director world.
absolutely, I think just as a CPEP fellow, it's I think I benefit from my journalistic experience, as I was saying. I think being able to read a CBC and understand what physicians on rounds, or these conferences that we go to, what they're concerned about, and it's been really like valuable to me to kind of just know the language that they speak, right? Like, we are on the phone as CLS, a lot of the time with primary teams, and so you get familiar with communicating with them. And I think also, just specifically speaking to my processing experience before I was even like a CLS fully, like through undergrad, just seeing the just all types of specimens that are coming in, and trying to troubleshoot, especially, samples that have limited volume or send out testing or whatever have you, like trying to troubleshoot with like virtually every different type of tissue or human sample that you can have, has been just like a huge value to me. But as a fellow, because we're dealing with, a lot of just like problems that are coming in, troubleshooting that. But in terms of, yeah, being a director, like, I think on the other side, right, like as a director, as if you have a CLS background, you have the advantage of understanding the mindset that we kind of are trained to have as bench scientists, that is pretty unique, and it's great in my opinion. But I think as a director, it will be a great advantage to have understood the other side. Yeah.
Yeah, definitely. There's a lot of like troubleshooting skills, investigational things. There's, very good knowledge of things, especially as you progress in your career. In micro, there's so much knowledge that you need to have, and as you get more proficient, right, you start learning more and getting more acquainted with things like resources, so you become very knowledgeable. So yeah, definitely a lot of good qualities, and I'll ask you a little more about the application itself in a moment. But as a CLS, right, you're working on the bench. Sometimes many years pass, and sometimes people that become CLS, they find out later, as I said, in their career. So maybe they're a little bit older, and they're working. So there's some time that passes, that they haven't been to school. So that process, it can seem a little intimidating sometimes, right? Maybe there's the thought, but getting there to actually doing it. And for the audience, I know that sometimes their reality, because of a financial need or things like constraints, maybe that might not be possible, right? Just to take the time to go to school, even though there's a lot of progress nowadays and a lot of online programs for the working force. But having said that, maybe that thought of, "Oof, this looks like a good option. Maybe it looks something that I might want to do, but oh, getting back to school and doing things like that." So, any advice that you can offer CLS professionals who might be considering, graduate school, and but they feel intimidated by that?
For sure, it can be intimidating. Like I was intimidated. I felt very fortunate to have been, sort of pushed by, some of my mentors and just like some of the other CLS, some of my coworkers, that sort of pushed me to go back. But I think it's definitely harder the longer that you're not in school, as everyone says. But there's a certain like middle ground. There's a middle ground for me at least. It was good to have more lab experience. Just time, seeing more things, seeing because testing's changing, and so you're kind of seeing how things change and how to bring in new things. Like it's definitely good to get some good time in there, and then also financially, right? Like just you said, logistically, it's like if you do into grad school, if you do go into grad school. It's a grad school stipend and it's a long, like 5-ish year road. So it's something that everyone kind of has to consider personally. And, I I don't think, and again, like geographically, you may not have a program around you that has, and we could talk about this more too about like the types of programs that would kind of set you up for to get a PhD that's clinically relevant for, if you do your thesis in something that's clinically relevant. And so you want to select the programs, accordingly. Yeah, geographically you could be constrained, and then even going into CPEP fellowship, like I knew I was going to have to move. But it's just not enough programs. Maybe you're really lucky and you have a great, you get somewhere that's close to where you want to be. But yeah, there's a lot of moving involved, unfortunately, and so is not a reality for a lot of people, which is totally understandable. But I don't think anyone should be afraid to apply. Just if they can see it as a feasibly working for them, but I would say do give yourself a chance to build up your skills and experiences, to make your application strong. And the way I think you do that is to say yes to things and say yes to projects, and just be willing to jump onto you know activities outside of just routine testing.
Yeah. If you are able to go for it, go for it. And understanding that there, as you said, right, that there are some challenges when it comes to might have to move or things like that. And you have to keep that in mind as you're going through all those decisions. But yeah, definitely do it. I started my master's, I think it was like 9 years after I finished my undergrad. I went back to school and I just did it. It was pretty good. Maybe it got a little challenging at the end, juggling with a lot of things, but that's just me, right? I can't do one thing. I was teaching, podcasting, working, and then going to school, right? I guess I don't like having free time, but it was just it was a lot, but then it's totally worth it. So if you're up for the challenge and you can do it, definitely go for it, and just educate yourself and be aware of what you have ahead of you, and go for it. So regarding the application, right? So I'm not sure how competitive this is. But this can be either applies to a graduate school application or a C application. Maybe you can talk about both, about what things can you do to strengthen your application.
Yeah, I mean, it's tough, especially, and I do want to kind of mention, like, we're kind of in a unique time for academic research. my PhD cohort had 5 individuals that entered and finished the program, but the year I left, there was, funding uncertainty and programs are cutting here and there depending on what's happening, and they didn't take any PhD students the year that I left, just for various reasons. So I think there is a climate of it may be a little bit more competitive to get into these biomedical PhD programs that are previously really well funded, but hopefully this changes in like a year or two. Like, I think we're kind of saying that about a few things, but yeah, in terms of your competitiveness, I guess the word is for that, your attractiveness as a PhD applicant. I definitely think CLS, uh, your CLS background has a lot of benefits that you can kind of play into, and advantages that you uniquely have. But and then in terms of just the CPEP programs, there's very few programs. I think there's probably, I think from what I heard from one of my colleagues, one of the programs had about 100 applications for one slot this year. So, and generally, most people apply to multiple programs. I applied to all but a few that just depending on like geographic fit. But I'd say most applicants apply to most programs. But yeah, it's most programs are receiving a lot of applications for one slot, and do everything you can to make yourself competitive. I think the CLS background is something that does that. So
Yeah, and some of the things that you mentioned that you did as a CLS, they help as well, right? Like you getting involved in a lot of things like those projects that you mentioned, and that they lead to publishing sometimes, and that also that looks good, and going to those conferences and presenting posters. So it shows how, I guess, how involved you are, and your desire to learn, and getting so involved in the profession that you're out there working on things, and validations and presentations and things like that, which is very important. So if you're listening, get involved in a project. I know that sometimes, as I mentioned, it gets busy, and the idea of having something besides your work, right? Because you want to go home, it can be challenging sometimes. So, but if you have the opportunity, go for it. And a lot of times, you see emails out there, hey, we're gonna start validation, and volunteers, jump on it, and it's a good experience. And then you get to go sometimes and present posters and things like that, and you network and you meet people and you learn more about the profession itself, and then you can start seeing more possibilities. I went to my first conference, and it opened like a world to me about, oh my goodness, there's so much more beyond what I'm doing in the lab, and so many like-minded people, right? And I just always say, like so many nerdy people like me, and it's great. So don't constrain yourself, get involved in those things. So let's go ahead and talk a little bit about um your PhD work, right? And then, which brings a very interesting theme, um, because nowadays, we hear a lot of, right, sequencing. That's very, a lot of talks of regarding sequencing. And if you went to microbe, you see that, and you're seeing even with the exhibitors and vendors. So you're seeing a lot of this theme. So in your PhD, you work with HIV tissue reservoirs, and you did long read NGS. Maybe tell us more about that, and what interests you about sequencing technologies.
yeah, so the lab that I did my PhD in, they're sort of a HIV, neuro HIV. They historically have worked on neuro HIV, and so we in the lab obtained some tissues from different repositories that were um, basically frozen brain tissues from like the early 2000s, and of individuals that passed away with HIV, during the HIV/AIDS. And so we were able to ask some questions about HIV in the central nervous system, and using those tissues, because even today, with art, with antiretroviral therapy being, as great as it is, you're still individuals still experience, a certain portion of individuals still experience these HIV associated neurocognitive disorders, like you know forgetfulness and just other um, measurable cognitive impairments that aren't really explained by a viral load because people are suppressed in their viral loads, and so we really wanted to look at what what the HIV reservoir, because HIV integrates into the chromosome, and what that looks like in the tissues where we're seeing pathogenesis. And so, in order to do that, you need to sequence the entire HIV genome, which is about like 9-10 kb. And so, long read sequencing using platforms like Oxford Nanopore, PacBio, and so if you think about sequencing Illumina, these like short read technologies are like less than 1,000 base pairs, basically, and then there's other technologies that do the long read sequencing, and so that's the type of sequencing that have the most experience with through my PhD. We were doing some Sanger sequencing at UNC, and so that was actually a really good thing to have on my resume when my PI was looking for people to start this sequencing project in grad school. Someone with sequencing experience already is a big pro, because it is different from normal, lab testing. It's a great skill, I think, and so that's something that I recognized, kind of leaving the hospital and the CLS environment, and something that I wanted to kind of have experience in because I knew it's going to be important in the future, which just molecular diagnostics in general, I think, are becoming even more and more prevalent in clinical labs.
Yes, definitely, and there's still a long way, to go, and as far as making that like a possibility, right, for a lot of hospitals. But I just wanted to get your opinion as a as someone that train and work as a CLS, right? This field is changing a lot, and it just continues to change at a rapid pace, I will say so. And sometimes change can be daunting, and especially learning, we already have so much information to keep up with, right? And on and our work as microbiologists, and so where do you think we stand? Is there some, as far as CLSs and learning about sequencing and genomics? Do you think there's some hesitation about learning about the subject, and if so, why do you think that is?
Yeah, I think definitely. I think well, for one, when I was in school, at least then when I was in CLS school, they did not seek, and just for one reason, it wasn't that prevalent at the time, but they did not emphasize sequencing technologies and teaching. I'm not sure. I mean, I'm not sure. I would love to hear your opinion. Actually, is like what in terms of education now, like, and just the general attitude of CLS, regarding sequencing, but it wasn't taught because it's not on the board, and then on the board exam, and and I mean, I guess, to add, like, genomics itself, sequencing in the wet on the wet lab side, like, you can do it. Like, I understand it's intimidating and it's different from our routine testing, but I think it's something that you should just at least try to observe and see. I think it brings you a lot of skills. But in general, like, genomics and sequencing as a whole is intimidating for most of my cohort, my CPEP cohort. And so, but I think in terms of analyzing data and the tools to interpret the sequencing data, they're becoming more approachable. I think that's something um, that's becoming more accessible, I guess, and less intimidating, hopefully. So yeah, I'd love to hear your opinion as well.
Yeah, it is a lot of information, and it's not impossible to learn, right? And I know, like, it can seem, because yeah, there's something that maybe moving forward we should. And I don't know, as far as the MLS programs, and I know that there's the challenge of, you have an X amount of time to cover certain topics, and even things like antimicrobials. You brush on them and you go over some categories and your basic things, right? You talk about MRSA, VRE, and things like that. And you learn a lot of the stuff on the job because there's not enough time. It will be a 4-year program where you're doing all this stuff for 4 years. So I understand that. I mean, moving forward, we should start incorporating maybe like a class, or because the one time that I really got involved with bioinformatics is because I took a class in grad school when I was doing my master's, and it was a lot of information. Oh my goodness. And They have some good videos explaining things, and it was frustrating when after you're doing all the work right and putting your data on like on blast, or and then you get the wrong thing, and I'm like, what am I doing wrong? And then you go back, and so it should be, yeah, it should be incorporated more. I was talking to someone in micro that she's part of a microbiology program then at the University of Florida. That one of the things that it recently started just in the spring, and she's gonna do that. Like she's gonna put it in the curriculum and make sure that the students have some exposure. So that's something that we should do. I think that as in the bench itself, a lot of people are eager to learn. We're seeing a lot of with all this, we're getting a lot of new people, right? Because we had that transition with a lot of people retire, and then we're getting an influx of young technologists, and there's that desire to learn. I've seen that in my hospital. If those that some people ask for it and they get trained on it, so they're willing to learn. I think. Um, there's always the challenge that some people maybe don't want to get involved in new things, and there's that time constraint at the hospital, right? So just spending this time and doing this and that. Um, a good first step is involving it in a program.
Yeah, and I think not every hospital has sequencing capabilities in house. So I'm not saying sequencing is the end all be all. You need to have sequencing experience to go to grad school. I'm not saying that at all. There's obviously many different expertise that are valuable. So yeah.
Okay, so and then that leads me to based on the direction that we're going, right? Where you see like this is something that it keeps coming up and up and up. So maybe you can talk about the importance of future microbiologists to become comfortable with technologies like this.
Yeah, I mean, in terms of I'm biased because I just think it's really cool. Like I love sequencing, and just finding out we're just finding out so much more information. You find so much more out uh, information out about a bug, based off of its genome rather than what you can see on a plate. Like even if you do like a disk setup and all these biochemicals, like you're learning a limited amount of information about that that isolate or whatever have you. So I think molecular molecular diagnostics and just sequencing in general, it's not absolutely not the best test for every area of micro. Like we're still going to be using culture, like everyone. It's not going to just take over the whole lab, but I think to address some challenges that we're having, like for example, like volume, everybody's volume's going up. What can we do to get some like automation or molecular assistance for certain things, and just as resistance. I'm sure some of the talks at Microbe, some of these bugs that we're seeing, especially in these like long-term care facilities or, just transplant patients, like these really sick patient populations. Um, the resistomes that we're seeing kind of is going to start necessitating rapid susceptibility testing, and so I think sequencing is a way to do that. There are some platforms that are being explored that are like phenotypic rapid, but there's still it's a molecular sort of based technology, and so I think a lot of areas of the lab, are going to start to benefit from these things, and just in terms of a patient care perspective. And it's important to to get with to move with the trends and what we can do in terms of best practice. So
Yeah, no, we're seeing so much molecular testing, and yeah, that was a big thing, and we're seeing a lot of that like rapid AST things, and a lot of this this test that now you're getting from different sources, and they have made some great advances. I mean, one of the challenges that we have in micro, right, was growing the organism and then doing the susceptibility testing, and a lot of time passes from that, and some of these patients, they're very sick, and that can be a long time to get them on the proper treatment. So we see that, and a lot of these tests, they complement, and we are learning so much, right? Before even the moldy days, you had like this limited knowledge of organisms, and then moldy opened that door, and you're seeing all these names, and now you're doing that with sequencing, and you're getting all this valuable information, right? Like like resistant genes, and you're using it for surveillance, epidemiology. So there's a lot of value in it. So it's we have to get comfortable with it because that's a big part of our job. And maybe now, and I understand as you're listening, maybe in your lab you don't even have something like a molding yet, and just so maybe your technology is more limited. But the way that this is going, we're getting more centralization, right, with microbiology, and so that's the direction we're heading. So we have to keep up with the times and get very comfortable with it to continue doing the best work we can for our patients. So okay, so you're looking back at your journey, and what message will you give to a person that's considering a similar path, like the one you took?
I mean, looking back, in terms of would I go for my PhD and do a CPEP program again? Absolutely. I love my job. I'm kind of it's I just feel so lucky to be in the position I am, and being able to help make decisions, and move the field forward in any way I can. But in terms of, I guess that's a good sign, right, for someone that's considering it. Like I absolutely would do it again, but not everyone is going to be in that situation, like I said, financially, geographically. And then something that I think it's important to recognize is, when you're a CLS or um, working on the bench, you clock in and clock out, right? And then like at 3:30 or whenever your shift's over, you go home and you come in the next day. And but there's still like a lot that's going on in the evenings, on the weekends and stuff. And so like being a CPEP fellow and being a director, it is sort of like a full-time 24/7 job. And it's tough sometimes, but it's part of it. And it may not be the right fit for everyone, and so that's something you kind of need to consider. If it depends on how busy your hospital is. Like these large academic medical centers, you have multiple directors, and so you're not on call all the time. You have, your colleagues are maybe more specialized in certain areas than you, like AFB, for example. And so, like, people are kind of in charge of their own sections, and those paces are all different, right? Like in terms of like how responsive you have to be, and just like the decisions that have to be made, and but that like you sort of have to be available all the time. It's and you're always sort of thinking, and yeah, just it's always you always have the lab right here, so it's like um, it's not the best fit for everyone if you're someone that needs to kind of like shut your mind off from work. And I still I dissociate in my own way. I have my hobbies and things that I like. I go to, but it is a very full time job, so that's definitely something to consider. And then, yeah, it is competitive. So it. I would say even if getting your PhD, even if you decide at that point, oh, I don't know if I want to go back to the clinical lab. Like I kind of do like either research, like biomedical research or academia. I think um, that's also great. And I think your PhD and your CLS background can still make you valuable for other opportunities that aren't necessarily being a CPEP director. And I think there was a few sessions maybe at Microbe that kind of talked about other pathways other than clin micro labs.
Yeah, and I know, through my journey here in Let's Talk Biker, I have seen, people in the industry that, that they work as things like as, medical science liaisons, and they do other types of job besides your traditional director, and they have that training. It's so true what you said. If right, some people do want to dissociate, and some people, right? So I remember that was like a nice feeling when, in a way, right? I remember the early days when you just finish on a Friday and boom, you don't. For the most part, I'm always been, I do like a lot of these things. They do follow me home, and I do worry about them. Hopefully, that ID came in, even if it's a Saturday or a Sunday. I'm always thinking about that, or I hope that we're able to finalize this culture because it's been floating around for 4 or 5 days. So it's a lot of those things, right? And then there's the most basic one where did I put my plates in the incubator? Oh my goodness, if I left them out, that fear. So a lot of those thoughts they come into your mind, and you have to be prepared that yeah, that's a job that even though you're off, you're not off because you're a phone call away, you're a text away, and it doesn't even end. You see it's interesting. You see, you go to these conferences and you see a lot of people, with their laptops and right between sessions, they are working, they're writing, they're taking time. The work continues, and it is true. Me as a bench tech, I try not abuse, but not overuse it. If I'm able to troubleshoot something and I know that if I can do it, I will do it. And but there are some things that require a decision from someone higher up, and you have to. So it's always, you feel bad, doing that text on a Sunday or a Saturday. Hey, I have this problem, but that's, it's part of the job. So that's something that you have to get comfortable with, because it's part of it. So, but having said that, yeah, just, I'm going back to the thing that if you're working, and sometimes some people are very happy and very comfortable where they can work the bench for 30 years and they're very happy about it. Like I do my 8 to 5 and then I go, I don't know, hiking on the weekends or doing this and that, and they're completely happy. And there are some people that sometimes they feel they can do a little more, something different. So start, talking to people. Like I said, get involved in things, go to conferences so you can see what's out there. The people are very nice. So always they're an email away. So if you have questions about a position or what type of education it requires or things like that, they're always an email away. So reach out to them. People are friendly and they want to talk to you. Okay, well, before I ask you the last question, which is fun, it's meant to end on a lighter note. Any closing thoughts that you have about this?
Oh, yeah. I mean, I just think I just am passionate, I guess is a way. I care a lot about this field. I feel really grateful to have had the support that I've had coming up to this. I feel